What's my solution? It is the solution that exists in every other industrialized democracy, and that is a not-for-profit healthcare system. Now, I'm the co-author of the bill. To me, this isn't a casual question. I want to go back to your experience. Under the bill that I propose, you'd be covered. Wouldn't matter if you didn't have money or not. Wouldn't matter whether you were working or not. You'd be covered. And now what would be covered? Everything. Everything. Basic health care plus vision care, dental care, mental health care, prescription drugs, long-term care, everything's covered under this plan that I'm the co-author of for a not-for-profit Medicare for All, H.R. 676. Now, this bill has 72 members of Congress supporting it. This bill has hundreds of labor locals supporting it. It has 14,000 physicians who've endorsed it. This is a national movement. This bill has had the support of Michael Moore, who said that this is the one bill and that I'm the one candidate in the presidential race who's brought this issue forward. When you start talking about paying $400 a month for health care, if you were to turn around and do that, you wouldn't have the money you need for food, you wouldn't have the money you need for basic household expenses, you wouldn't have the money you need for transportation. See, this is where American families are really up against the wall on this issue of health care. I see this, by the way, as being the #1 domestic issue. Now, why is it, having had a Democratic president before, and why is it with a Democratic Congress right now, this thing isn't being pushed to the forefront? I want you to take a walk with me on this issue. In 2000, I brought a not-for-profit healthcare system plan to the National Platform Committee of the Democratic Party. And I was told by the Gore campaign, we can't be for this because we're getting too much help from the insurance interests and we can't take them on. They're helping us. I was told this by the campaign. At the top, not just somebody in the lobby. 2004, I took the same proposal to the Democratic National Platform Committee. It was rejected again because the insurance companies are said to have, too many favorites inside the party. In 2008, I'm on the campaign trail. What am I hearing from some of my friends who are on the campaign trail? Senators Clinton, Edwards, and Obama all good people, they all say, we just can't take this fight on because we can't break the hold which these insurance companies have. So they come up with another approach. Let the government provide more tax dollar subsidy to the private insurance companies so more people will be covered. Which means we're still locked into premiums, copays, and deductibles. Which means it's still a rotten issue at the bargaining table, which means that people will still not be able to get the coverage they need, which means the affordability and accessibility and all those issues, we're in trouble. Now, this is the issue domestically that separates myself from all the other candidates. Because I'm saying, time to get the for-profit out of health care. Americans spend, listen to these numbers, $2.2 trillion a year is spent for health in America. 31 cents on a dollar. 31 cents on a dollar goes for the for-profit healthcare system. Corporate profits, stock options, executive salaries, advertising, marketing, the cost of paperwork, up to 30%. That's over $600 billion a year. You take that money and you put it into healthcare, and suddenly we have enough money to cover everyone. People ask me, they say, well, what am I going to have to pay more? No, we're already paying for it. We simply use the money we have now for a not-for-profit system. This is the issue that separates everyone. Now, some of these candidates, and I don't need to call names, but they're getting money from Wall Street interests who are absolutely opposed to anything that involves ending the not-for-profit system. There are people making money off of this system. You have to remember this. There are people who have investments, heavy investments in these insurance companies that make money not providing health care. And if people really want to see the system change, that's what I'm ready to do. People say, oh, you can't challenge these interests. As I close, I want you to think about this. Someone wants to be president of the United States. They sure better be able to stand up to the health insurance industry. They better be able to rally the American people in the cause of health care. They better be able to identify health care as a basic right in a democratic society and not a privilege to be distributed based on ability to pay. This is the issue, that we have to restore the American family, that we have to restore the dignity and the economic viability of the American family. And I'm ready to do it. I'm ready to show that kind of leadership, and that's one of the main reasons I'm running for President of the United States. Thank you.